Okay, hi everybody. Welcome to the back end of Chapter 15. We want to talk a little bit now about cumulative trauma. Cumulative trauma disorders, also known as repetitive motion injuries, are common to numerous occupations and account for more lost time from work than any other single factor. Um, think about occupations in which you do a lot of repetitive tasks over and over again. It's not so much the force exerted by any single task, but it's the accumulated wear and tear on muscles and joints as a result of things like bending and stooping, or typing at a keyboard, or stacking, or going up and down steps with a heavy load. All these things can add up to cumulative trauma. So one of those you've probably heard about is carpal tunnel. So let's take a listen to carpal tunnel.
Tying rebar is hard, physical work. It's also an example of a job that involves repetitive use of the wrist. Use that can cause problems such as carpal tunnel syndrome. Carpal tunnel syndrome is a condition that interferes with the use of the hand. It's caused when too much pressure is put on the nerve that runs through the wrist. To understand carpal tunnel syndrome, it helps to understand the anatomy of the wrist. The wrist contains tendons and nerves inside a narrow tunnel. This narrow tunnel, the carpal tunnel, has a fixed diameter. In carpal tunnel syndrome, symptoms occur when there is pressure on the median nerve. This pressure on the nerve in the narrow tunnel of ligaments and bones causes the symptoms. Some of the symptoms of carpal tunnel syndrome include numbness, tingling, and pins and needles. For more information on carpal tunnel syndrome, visit WorksafeBC.com.
And let's take a listen to tennis elbow.
I get a lot of questions recently about tennis elbow. I'm the developer of the Handmaster Plus, which we sell to therapists and athletic trainers, occupational therapists, many other hand therapists, for example. And so we do get a lot of questions about how tennis elbow occurs and what it is, and I just want to briefly address some of this. It is actually fairly simple, but some of the things that we've discovered about tennis elbow might be new, probably new to all the lay people and even new to some of the therapists that we have watching this video. Tennis elbow, very simply, is a word that is for the condition of lateral epicondylitis. It sounds like a real complicated word, but anytime you see itis in any condition, that means inflammation. Okay, so itis just means inflammation. The lateral epicondyle is an area of your upper arm bone, of the humerus. The lateral epicondyle is on the outside. Lateral always means outside, and medial means inside. So you have two epicondyles which are just bumps that muscles and the tendons insert onto. And so the lateral epicondyle is over here, and the lateral epicondyle is the origin for the muscles, the finger muscles that extend the fingers, and also the wrist muscles that extend the wrist. Okay, so we have to ask ourselves, when the lateral epicondyle gets inflamed, which is lateral epicondylitis, what causes that? A lot of times I think we hear tennis elbow, and we forget about the cause of it. We're so busy concentrating on the name of it. Okay? So just like any other inflammation is usually from one of two things: overuse or weakness. Okay? So with tennis elbow, what is the most misunderstood thing is that what do these finger muscles do? What do these finger extensor muscles do? And what do these wrist extensor muscles do? Tennis elbow happens a lot in anything where we're gripping something. And I've talked about this on other issues, but I want to go through it with people that are using it specifically for tennis elbow. Anytime I grip something, what we think about normally is that the muscles that close their hand are only working. But what I can tell you is what muscles that are working just as hard are these finger extensor muscles that originate from this lateral epicondyle. Okay? They're working just as hard to support whatever you're doing gripping, whether that could be sports, that could be music, that could be in the workplace, could be in crafts, could be anything. Okay? If these muscles weren't working, these finger extensor muscles, imagine the fingers would just go like this. When we tried to flex something, we couldn't do it. Most of the time when we feel fatigue in any activity where we're gripping for a long time, sports is really, really common, music is really, really common. The fatigue is coming from the fatigue of these finger extensor muscles and wrist extensor muscles, because they're the muscles that are generally not strengthened very much. Okay? So that's a really quick thing about tennis elbow, is that if we want to prevent tennis elbow, we have to make sure we strengthen the finger extensor muscles. The product that we developed to do that, I think most people are starting to know about it now, is called Handmaster Plus. I'll show you it right here. It's very simple. It goes onto the thumb and then onto the fingers. And what it allows us to do is train not only the finger flexing muscles, the muscles that close, but those finger extensor muscles. Okay, so every time I train those finger extensor muscles, I'm going to make them stronger, I'm going to bring better blood flow to that area, and I'm going to prevent this tennis elbow that we see so commonly. So all I do is I close against the ball, open and spread against the court, close against the ball, open and spread. Now instead of 3 or 4 different exercises, I do one continuous exercise, and I will tell you that now we're going to keep these finger muscles strong, we're going to keep good blood flow, so we're going to have a nice, healthy insert or origin for that muscle at the lateral epicondyle, and therefore we're going to have very little chance for lateral epicondylitis. The other problem we show people that use their hands a lot is to really isolate the finger extensor muscles and the wrist extensor muscles, is to do this exercise. Squeeze against the ball, keep the thumb on the ball, extend just the fingers like I'm doing right now, then extend the wrist backwards. So 3 steps. Squeeze for a count of 1, extend the fingers for a count of 2, extend the wrist for a count of 3. Squeeze, extend, extend, squeeze, extend, extend. You can see each time I do this exercise, not only am I strengthening the finger extensor muscles, I'm also strengthening the wrist extensor muscles, and now I'm going to strengthen all 5 muscles that originate at this lateral epicondyle. And I can tell you, if you do these 2 exercises, you squeeze and open, then the 3-step exercise, like so. Even if you use your hands a lot, you're going to have a very, very low chance of having any kind of tennis elbow or lateral epicondylitis. To get this product, you can go to doczac.com and you can buy it online, or you look at any one of our distributors and brand partners. And once you get it, it's very, very affordable, very mobile. You can carry it with you anywhere you go, and it's easy to do. There's no excuses to not do your exercises and prepare so that we prevent tennis elbow or lateral epicondylitis.
Okay, trigger finger is an abnormal condition in which flexion or extension of a finger may be momentarily obstructed by spasm, followed by a snapping into place. It's usually caused by difficult and repetitive finger movement of the index finger and trauma to the tendon. The treatment is cessation of the repetitive motion and rest. Prognosis is generally good with prescribed treatment. The types of activities that could produce trigger finger might be something as simple as opening a door with a handle, or squeezing something in order to, let's say, eject the contents from a container onto something else. Anything that has a grasping, repetitive motion can result in problems with your trigger finger. If you look at your hands underneath the skin, there are a lot of tendons that connect the phalanges to the metacarpals, and it's very easy for them to become stressed and strained if the activity isn't spaced out, isn't interspersed with a potential to relax and recover from that type of activity. Next thing we want to talk about is thoracic outlet syndrome.
Hello, I am Dr. Julie Freischlag, and this is the Society for Vascular Surgery briefing about thoracic outlet syndrome. Thoracic outlet syndrome encompasses 3 separate conditions related to extrinsic compression of the neurovascular structures that pass through the thoracic outlet, which is the anatomic space posterior to the clavicle and overlying of the first rib. Neurogenic thoracic outlet syndrome comprises 95% of diagnosed cases. Venous thoracic outlet syndrome, comprising 3% of cases, occurs when the subclavian vein is compressed by the subclavius tendon and anterior scalene muscle, resulting in thrombosis. Venous thoracic outlet syndrome is also called Paget-Schroeder syndrome. Arterial thoracic outlet is most rare, 1% of cases, and is caused by arterial compression, leading to thrombosis, aneurysm formation, and/or embolization. Oftentimes, it is associated with the presence of a cervical rib. The diagnosis of neurogenic thoracic outlet syndrome is difficult to make. It is based on the history of repetitive motion activity or work or a traumatic accident and confirmed by a physical examination that reveals a tender anterior scalene muscle, ulnar weakness, and a positive elevated arm stress test. A positive Adson's maneuver, which is loss of a radial pulse with abduction of the arm, or a bruit in the subclavian artery with abduction, confirms the diagnosis. EMG and nerve conduction velocities are usually normal. The presenting symptoms of neurogenic thoracic outlet syndrome are pain, numbness, and weakness in the affected extremity. The symptoms are usually associated with patients who have repetitive motion activity or work, such as a mechanic, hairdresser, or prolonged computer activity. Additionally, some patients suffer an injury, such as whiplash in a car accident, that results in spasm of the anterior scalene muscle, causing neurogenic thoracic outlet symptoms. The mainstay of therapy for neurogenic thoracic outlet syndrome is physical therapy. Physical therapy improves symptoms in 60% of patients. Those patients who do not improve with physical therapy can undergo a first rib resection and anterior scalenectomy to relieve the compression of the brachial plexus and spasm of the anterior scalene muscle. A scalene block with lidocaine can provide temporary relief, about 4 hours, and can predict the successful outcome of the operation. Botox injections in the scalene muscle can provide relief for up to 3 months and help the patient progress with physical therapy. It is most helpful in those patients with a history of a traumatic accident. The operation can be performed through a supraclavicular or transaxillary incision. Physical therapy must follow surgery in order to increase the range of motion, improve strength, and prevent scar tissue formation. Venous thoracic outlet syndrome presents with acute swelling of the affected extremity, resulting from the thrombosis of the main vein draining the arm. The acute treatment should be thrombolysis to dissolve the clot, followed by anticoagulation and then first rib resection and scalenectomy. The first rib can be removed immediately as well. A venogram and angioplasty should be performed 2 weeks following the operation to dilate the vein. This cannot be done until the rib and muscles are removed, eliminating the extrinsic compression. These patients tend to be very active, such as athletes or musicians, and can return to their sport or craft after the vein is restored to patency. Some patients present with intermittent compression of the vein with intermittent swelling and can undergo a first rib resection prior to thrombosis. Arterial thoracic outlet syndrome needs to be addressed surgically by removal of the first rib, anterior scalene muscle, and the cervical rib if present. If an aneurysm is present, it should be resected and replaced with a saphenous vein or prosthetic graft. If the patient presents with an arterial occlusion, thrombolytic treatment can acutely open up the artery, and then the first rib and/or cervical rib can be resected. If a cervical rib is present on the contralateral side, prophylactic resection is recommended. This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.
Okay, now let's talk about tendinitis. Tendinitis, also spelled tendinitis, it can either be O or an I, is an inflammation of a tendon that's usually caused by an insult or injury to the tendon and usually accompanied by pain. Calcium deposits may be present with tendinitis. This is an example of opportunistic ossification, the production of bone where bone isn't normally found. Nonspecific tendinitis is often difficult to diagnose unless there's a thorough patient history that reveals a precipitating event. So how do we deal with it? Treatments include reducing pain and decreasing inflammation by resting the affected limb, oral inflammatory drugs, applying ice, and steroid injections for the short term. This often occurs in the shoulder. Prognosis is usually unpredictable because the treatment may not always alleviate the pain or increase the mobility. Okay, now we move into a totally different type of trauma. We're talking here about psychological and physical trauma that comes with assault. Child abuse and neglect is physical, psychological, or sexual injury to a child and is considered child abuse. Physical abuse is the most common. Neglect is also considered a form of child abuse, and this is a reportable occurrence. Child Protective Services is one of the agencies that is generally called on to intervene in these types of cases. Children who are victims of child abuse are often identified by teachers, daycare providers, or healthcare workers. The injuries can include bruises, fractures, burns, bites, and welts, and the injuries can also be fatal. Child abuse and neglect usually has telltale marks of physical abuse. Bruising, for example, hand marks or imprints of cords or hangers, or welts that come from a belt. The bruises can appear on soft tissue and may appear in various stages of healing. Dipping lines indicate that the child may have been held in scalding water as a type of discipline. More telltale marks: burns. Cigarette burns, small circles on the hands, feet, buttocks, or genitals. Scalding burns are a pattern of dipping with no splash marks. Other signs: teeth bites, whether they be human or animal, fractures, and lacerations. So what are the symptoms? The child is often withdrawn and avoids eye contact and doesn't respond appropriately to painful stimuli. To protect the abuser, the child may deny any abuse when asked, and this makes sense in terms of the dynamic that exists between the abuser and the victim, because they're probably afraid that the abuse will escalate if they report any such activity. The child might exhibit aggressive behavior and have a neglected appearance. So what are some of the causes? Emotional immaturity of the abuser, stress caused by economic or social difficulties, poor parenting skills, drug or alcohol abuse, history of the abuser being abused as a child, and unrealistic expectations of the child, along with limitations with a physical or mentally challenged child. Prior abuse usually repeats itself as a pattern. Healthcare workers, teachers, and daycare providers are required in most states to report suspected child abuse to local or state child protective agencies. How do we treat this? All injuries must be treated in a manner appropriate to the wound. Radiographic studies might be indicated to assess suspected fractures, and we want to provide emotional support to the child. Abusive parents and other perpetrators need professional help from the appropriate agencies. At what point should a child be removed from the home if the abuse is discovered? Immediately. And what type of emotional support would best help a child who's being abused? Psychological counseling, along with appropriate medical treatment. Okay, the next type of child abuse you want to talk about is shaken baby syndrome. So take a listen.
Now that you have a newborn, you're going to hear a lot of this. And it's important for you and your baby's caregiver to remember that crying is baby's way of communicating. Baby may be hungry, too hot, too cold, need a diaper change, have a tummy ache, or just want to be held. What you never want to do is shake your baby, and you'll want to make sure no one else does either. Thousands of babies suffer from brain damage, blindness, or even death as a result of what's called shaken baby syndrome. Shaken baby syndrome involves shaking a baby by the shoulders, arms, or legs. A fit of frustration can cause a parent or any adult caregiver to shake an innocent baby. Just one shaking episode can result in bleeding in and around the brain, causing permanent neurological problems or death.
Never, never shake a baby. Babies are more susceptible to shaken baby syndrome because their heads are larger than their bodies, and their shoulder and neck muscles are weak. When a baby is shaken, the head whips back and forth, slamming the brain against the skull, causing bruising, bleeding, and swelling inside the brain. Shaking a baby can cause injuries like blindness, mental retardation, seizures, cerebral palsy, hearing loss, paralysis, broken bones, speech or learning disabilities, and even death. Even rough handling or hitting can cause similar injuries. Babies are an amazing gift, so remember, never, never shake a baby.
If your baby is crying, it's important to be a patient parent and see what your baby needs. Remember, crying is your baby's way of communicating. First and foremost, stay calm. Then you should try seeing if baby is too hot or too cold. Check baby's diaper. Feed or burp your baby. Offer baby a pacifier or toy, or simply hold your baby. You can also try taking baby to a quiet room. Hold baby to your chest and walk or rock gently. Take baby for a ride in the car or stroller. Put baby in a swing. But never, never shake a baby. Babies cry, and if your baby's crying bothers you, take deep breaths and count to 10 slowly. Call a friend or relative to talk. Exercise nearby. Listen to music. Read a magazine or book. Ask for help. Remember, sometimes babies cry no matter what you do. Lay the baby down on his or her back in a crib. Go to another room. Give yourself a short break. Be sure to go back and check on your baby in 5 or 10 minutes. No matter how tired, angry, or frustrated you feel, you must never, never shake a baby. If you think you might shake your baby and need help, call 1-866-243-BABY. If you think your baby has been shaken, stop. Calm down. Get help. Go to the closest hospital emergency room. Signs and symptoms of shaken baby syndrome include irregular, difficult, or no breathing, extreme crankiness, seizures or vomiting, tremors or shakiness, limp arms and legs, no reaction to sounds or acts lifeless, difficulty staying awake. Remember, never, never shake a baby is an important message to share with any person who's caring for your child, like a relative, friend, or daycare provider. Also, be sure to share the Never, Never Shake a Baby brochure with everyone who cares for your child. After all, you're a parent now, and this innocent, tiny person depends on you. And it's your responsibility to make sure he or she grows up in a safe, loving environment.
Okay, another type of psychological abuse that goes to the other end of the age spectrum is elder abuse and neglect. This is physical, psychological, or sexual injury to an elder. The most commonly observed forms are physical abuse. Psychological and sexual abuse are harder to identify. It's rare for an elder abuse victim to complain of abuse. Evidence of abuse is usually discovered as a result of examination for another purpose. What are some of the symptoms? Physical abuse and neglect is usually characterized by bruising, fractures, malnutrition, poor hygiene, and poor general health status. Leaving the elder unattended, especially for a prolonged period of time, constitutes neglect. How might a child become so stressed with the care of their parent that they become abusive? Well, basically, stress building to the point where they have a breakdown and they take out their frustrations on the object that they're caring for. But if this is an extended pattern, then obviously agencies need to intervene for the safety of the abused and the abuser. So what are the treatments? Appropriate treatment of the existing trauma, removal from the abusive environment, and counseling for all parties. What type of community resources could help families deal with elder abuse issues? There are a variety of social services available, part of public health initiatives around the country. How might the elder feel towards their son or daughter who's neglecting or mistreating them? Well, it's hard to say. If they're senile, they may not be aware or they may not be capable of communicating the abuse. However, if they are overly protective of their son or daughter, they may not report the abuse for fear that there will be repercussions for their loved one. It's difficult to understand that even if an elder is being abused, they will often still retain feelings of protection and love for those who are actually doing the abuse. So it's a difficult situation in which to intervene and sort out exactly what's going on. Okay, psychological or emotional abuse is the intentional and systematic diminishment of another person's self-worth or self-esteem. Although emotional abuse involves all age groups, children are the most frequent victims. Emotional abuse is often difficult to detect because the abused person may offer no complaints. Why might a person not tell others about their emotional mistreatment? Again, for fear of reprisal. Most abuse victims live in fear, and they don't want the dangerous situation to escalate. So what are the symptoms? Self-destructive behaviors are common, and they include eating disorders, obesity, alcoholism, self-mutilation, drug addiction, depression, and poor self-esteem and self-worth. Victims often turn their anger and rage inward on themselves. Those exposed to emotional abuse often have difficulty bonding in relationships. Why might a person turn his or her anger inward instead of outward towards the abusers? In order to avoid exacerbating the abusive situation. And again, you have to understand the dynamic that exists between the abuser and the victim. So what do we do about treatment? We stop the mistreatment, and we build up self-esteem and self-worth in the victim and the abuser, and we have counseling available for all parties. The victim often believes he or she is responsible for the abusive behavior and doesn't recognize it as abusive, so they misinterpret the activity. Victims often defend the abusers as a result. Okay, now we're going to move into another phase, and we're going to talk about domestic violence. So take a listen. now we want to talk a little bit about sexual abuse. It's been in the news a lot lately, and it takes many forms. It can be man to man, man to woman, woman to man, woman to woman. There's almost no variation of sexual abuse that hasn't been seen or reported at some time or another. So take a listen.
Sexual assault is any unwanted sexual activity. It includes rape, which is, without consent, penetration of the vagina, mouth or anus by a penis.
I was raped in a cubicle, a toilet cubicle in a club, and after making my escape, the ambulance pulled over and obviously recognised that I was very distressed. I was on the floor, I'd been beaten up quite badly, I was very hysterical. They took me to hospital. I was very dazed. I just see my friends stand at the end of the bed, and I looked to my right hand side and I see two police officers. When I asked them what had happened to me, they had informed me that I'd been sexually assaulted.
Well, the first port of call for someone who's been recently sexually assaulted may well be the police. Police forces have specially trained officers who are very well equipped to provide immediate support. They can also help bring someone to a sexual assault centre where we can offer a range of different things, including seeing a doctor and a crisis worker, offering a forensic examination to collect evidence if someone wants this. They may choose to have medical treatment to prevent unwanted pregnancy or infections, including HIV. They may choose to access support and counselling to help regain their control and confidence.
The police told me about the Haven, that they took me there, and they were amazing. Without the Haven, I would have never got through this. Without the help, the doctors, the nurse, the psychologists, psychiatrists, they've all been fantastic.
Rape and sexual assault can be profoundly distressing, both in physical and psychological terms. Anyone can be sexually assaulted, whether female or male, adult or child. Up to 1 in 5 women are victims of completed or attempted rape during their lives. Psychologically, in the immediate aftermath of a sexual assault, there are many problems. For example, anxiety, sleeplessness, guilt, self-blame, helplessness. Many people will recover partially or completely from this over the next few months, but many are left with long-term consequences.
I have had depression, very, very bad. I then had post-traumatic stress disorder, a lot of flashbacks. That sometimes I'd have nightmares when I could get to sleep, other times I couldn't get to sleep. The police had to put panic alarms in both my dad's house and my dad's wife's house, the 2 homes that I stayed within. I then had a suicide attempt in September, very, very bad. I actually did stop breathing twice, and they had to obviously resuscitate me. I had several seizures due to the overdose, but I just didn't want to be here anymore.
No one should be subjected to sexual activity without their consent. But if it does happen, a common reaction is to feel very guilty about it, to feel that they were in some way to blame. And so one terribly important thing that we can offer people in a sexual assault centre is to listen, believe and support.
Despite the fear, once I'd overcome that and I'd give my evidence, the moment I left the court, it was like the biggest weight off my shoulders ever. I felt like I'd released everything and I'd given it my all. I gave it my best shot, and despite the lack of conviction, it made me feel a lot better in myself. I felt that I'd done my absolute utmost to try and put that man behind bars and get him convicted of rape.
Sexual assault involves people losing control over what happens to them, and that's one of the many things that is so distressing about it. When someone comes along to a sexual assault referral centre, what we try and do is give people back some of that control over their lives by giving them choices about what happens next.
You're constantly moving forward, although at the time you don't think you are, but everything every process is one step closer to you healing and getting better. I do still think about it every single day, I'm not going to lie to you. It will stick with me for life. But it becomes easier. I was going to say get over it, but you don't get over it. You learn how to carry it around with you, if you like, and continue on with your life.
For more information, visit www.nhs.uk.
Okay. Physical and psychological assault trauma. Examples here would be rape. The preceding interview addressed this a little bit. Intercourse will be forced on the victim against his or her will. Rape is a crime of violence and domination and not a sexual act, and can occur on both females and males. The situations vary. There's date rape, acquaintance rape, and rape by the victim's spouse, and rape perpetrated by an unknown assailant. So how do we detect the symptoms? We look for bruising, torn clothing or disheveled appearance, withdrawal, anxiety, avoidance of eye contact, and evidence of semen on the body. Diagnosis is made by evaluating the history provided by the victim, the clinical findings, and the results of a physical exam, which include urinalysis and blood tests for STDs and possible impregnation. The treatment includes treating existing injuries appropriately. Law enforcement agencies should be informed. Counseling should be arranged, and we should provide information on the risks of STDs, pregnancy, and arrange for follow-up testing. We want to offer emotional support for the victim and for those closest to the victim. The victim should be reassured that the crime wasn't their fault. Recovering from psychological trauma of rape may take some victims quite some time. It can leave a long-lasting scar in the development of a lot of people. Okay, that finishes out the final chapter, chapter 15, and I'm going to see you all for the final next week. This is available on YouTube, so you can use this as a study aid. And have a nice weekend.